I am a physician in the US, but I am Gambian born, so I am a Gambian American. Here just doing some medical mission. The organization name is Ousman Koro Ceesay, but we call it OKC. Our goal or our mission is to make healthcare and education more accessible to underprivileged communities in the Gambia. We incorporate two of the most essential things or needs in basic human life, which is education and health. The organization was born out of my brother, Ousman Koro Ceesay, after he was killed. The brains behind the organization is my mom, Fatoumata Ceesay. She had the idea to develop this organization in his memory to build his legacy because he lived a short life. My mom actually started this organization I think about 10 years ago. She had this idea of vision of what she would like to do with it, which is my brother was really into youth empowerment. And so she wanted to have a school built in his memory so that people can benefit from that. And so as time goes on, we incorporated the healthcare part of it, which is that healthcare is also a huge deal in the Gambia where a lot of the population are not able to access it or afford it. And so we wanted to concentrate on that as well. And because healthcare is my background, it makes it much, much easier to kind of incorporate that into the foundation. We went officially registered in the US about 10 years ago, and my parents passed away, both my mom and dad passed away about 5 years ago. And so the reason why we do as a family, we continue this foundation, it's not just to it's to honor my brother, but additionally my parents as well. Because when they were in the Gambia, they both had medical emergencies and they both ended up passing away a couple weeks of each other. And when I look at it, it is simply because of the lack of proper healthcare facilities here that has caused them that. And for the longest time, if I must be honest, for the longest time, it was very tough for me to kind of get over that, because in my line of work, I pretty much save people every day. I save people's lives every day. So it was tough for me to realize that I wasn't able to save my own parents' life because they were here and the facilities were not, the greatest. And so that's our biggest issue. When we all come here, even when we're here for vacation for 3-4 weeks, you could have a medical emergency, and it could be you who ends up losing your life, right? Because you don't have proper treatment. So this is more of all of our issues, whether we're in the diaspora or whether we live here in Gambia, it's all of our concerns. It's not just the people living in Gambia who have to worry about not having proper healthcare or proper educational system. So we're all in it together. And so that's where the organization comes to play. For me, it kind of solidifies what is the work that I will be doing.
This project started almost about 4 years back when Dr. Ceesay came to Fajikunda to introduce herself as a medical doctor with a very useful and a very good program, like an initiative like to help Gambian, since she's also a Gambian, although she's residing in the United States.
This is something we've been doing for such a long time.
I met her in Fajikunda Health Center, where she came for the first time. By then, I was doing my internship here.
I met her since 2018.
Okay.
That was the first time that I saw her. Okay, this was the place that I met her even, because I saw her working and then without an assistant. So I joined her. I asked her, okay, are you working alone? She said, yes, I am working alone. So I said, may I join you? So that's what I did, and then we were working. I was checking blood pressures, vital signs for her.
Okay.
Yes, so that's how we do it, and then she is giving medication to patients.
My goal is to come in and help coordinate so that it's smoother, that we know exactly or have an idea of how many meds do we need, what kind of things do we need, what would make the bigger difference in what you're doing, and how can we do it a little bit more smoothly. That's kind of where my realm.
We try to go in more underprivileged communities. This time around, my sisters and I volunteered in Fajikunda, which it's our base that we go to.
The areas that she goes to, there is big gap of disparity as far as healthcare is concerned. These are very poor people. They can barely make their daily meals, let alone to have a good healthcare system in place for themselves.
I've been here for 2 weeks with Dr. Ceesay, and we've been going to a clinic every day, doing a free clinic, and bringing medications, trying to see people and get them some medications. We're trying to give enough medications for 6 months until she's able to come back again.
Most of them, they're in a health condition.
Okay.
Though some are suffering from diabetes. Mm-hmm. There are others who their joints and all of their body are pain.
Okay.
So we came here for medical check.
We also went to Katong and Gunjur, and the communities there were very much in need.
I'm very much happy because these people are giving medication free of charge. And definitely many people were here since early in the morning. They are treating people for free of charge.
Today we're out in one of the villages, and it's a very busy clinic here today. There's over 100 people, I think, waiting to be seen.
And we were so excited that so many people came in numbers. Like we saw a couple hundred in one day when we were in Katong, and we were so excited. And then Gunjur, a lot of people showed up too.
We started very small, but now that people know the work that we're doing, when you call, you see today people have been here from 6 a.m. and yesterday the same. So the more they know about the first few days that we come, the numbers they're large, but today it's exceptional. The numbers are huge. So that just goes to tell you the need that we have here in the Gambia to help our folks.
Since I've been here, I've been helping out with the clinics. We come in, we get set up every day. I set up the pharmacy, I help dispense the medications, I'll see people myself if they have very simple, skin pain, easy things, cough, cold. Dr. Ceesay, of course, sees the complicated clients that are here for diabetes or hypertension, but I can talk to people that have more simple things going on, and we've just been going from morning till night.
Today, what I'm doing is I'm just trying to get the blood pressures and pulse and their age so that I can give them a jump start in the next room. But what I did yesterday and the day before was I was taking care of the people with diabetes, refilling their medication, and people with high blood pressure. And I was refilling their medication and giving them advice as to how to take it, when to take it, and look out for the side effects. And on what to do. Like after they take it for a while, they have to go back to the doctors. Just don't sit home and think it's okay. You have to go and follow up so that they can know whether the medication is effective or not effective. So that way when we come back, we can follow up and see the medication that we are giving them, is it effective, and how we can go from there.
We try to go to these communities where they may not even have pharmacies there, or they may not even have treatment at their local health centers, and we try to provide them as much resources as we can and donate to that facility as well some of the garbs like sutures and antibiotics, that they could keep and then give to the patients for free.
Our relationship was very cordial, and not only giving patients drugs, but she also added her input to the development of the facility, because she has been giving us, because I could remember she facilitated through a fellow Gambian who supplies us with hospital beds, with other biomedical equipments, and then on her own part she also contributed giving us blood pressure machines, giving us sutures, giving us many biomedical equipments that today we are using, and then it has paid dividend.
It started little, but now it's going everywhere. We started Fajikunda, but now we go Fajikunda. Today we're in Karong, tomorrow Gunjur. And last time she went all the way to up the province, Fatoto and Basse.
We bring tons of medical supplies that are donated. In fact, this last time that I came, we brought almost $500,000 worth of medication that we give to patients.
What is so great about this whole thing is the quality of medications that they bring for these people. But she gives them enough, anywhere from 4 to 6 months supply. So by the time they finish, she would have been back to give them more for continuity of care.
Medically, I think that it makes sense to not just give one bottle of metformin to a patient, one bottle of antihypertensive to a patient. So what we try to do is do continuous care, which means we give each patient that we see who needs, let's say, diabetic medication, we will give you about 6-7 months of diabetic medication. That way it holds you over until we come back again. And then we can give you another 6 months of medication. That way there's no break or gap, there's continuity in care. That's more effective way of treatment than just offering everybody a bottle of medication that's going to last them just 1 month, and then the blood pressure will go back up. And so that's kind of how we work things out. And so to bring that much amount of medications, it's a lot of money.
This is the Gunjur Health Center. I came here, I met the head of the nursing unit, and he took me around. It's really sad. You don't call this a health center. They basically had no medical equipment. Drugs is out of it. She took me to their formulary room where they keep their drugs. The shelves had, I don't think they have more than 10 different classes of medication. So I'm like, how do you treat your patients?
The biggest issue here is that lack of medication and medical treatment facilities. That's the number one issue. People are not also able to afford the medication, because in order to get good health care in the Gambia at the moment, it seems like you have to always go to a private facility. Nobody wants to go to the public hospitals to get treated, because if we're going to be honest, there is nothing there. It's very low resourced. That's number one thing. And number two, patients are taking these medications and sometimes they don't even have the proper directions as to how to take it. So when we come, it's very time consuming in the fact that we tell all patients to bring their medication bags. So we go through it and we look at, what is it you're taking? Oh, this medication you're not supposed to take. This other medication is contraindicated. Because you have diabetes, you should not take this medication. But a lot of the general population is missing that education as far as what medications are appropriate for you to take and what is not.
It's been a really amazing experience. Really happy to be able to come along and watch Dr. Ceesay work. She spends a lot of time with each patient and gives them all of her attention, and she's a great physician to get a chance to see how she's working in the communities here.
What I feel and what I see is very encouraging anyway. It's very encouraging because you will go through all your sickness and explain a lot of benefits and what you should do, and give you a lot of advice.
We spend quite a bit of our time teaching the patients, okay, this is how much medications you have to take a day. Even the simple tactics of opening the medication bottles, we make sure we teach it to them, because some of the medication bottles are a bit tricky to open. So I open it and then I show it to the patient, and then I tell them to open it so that I can see and make sure that they can open it. Because if I give a medication to a 70-year-old lady in a village and she cannot open the medication bottle, there's no point in the medication because she can't access it.
In the Gambia, we have more of non-communicable diseases, metabolic syndrome, which include diabetes, hypertension, cardiovascular precisely, and kidneys, so those are very predominant here. So usually patients are are not diagnosed at the right time. So by the time they are diagnosed, the disease has already taken a toll on them. So it's very difficult to manage them.
For some reason in Gambia, we're scared to actually interact with the doctors. That's a cultural thing. Where I trained in the US, there's an interaction between the patient and the doctor. You have a question and I answer it. But here, they're very hesitant to engage with the doctor, and if the doctor speaks to them, they don't say anything else after that. And so I think we need to change that, because what that is doing is it's causing a lot of the patients to simply go home confused. And some of these medications, if you take it in higher doses, it can be fatal. And so that's where we try to make sure that patients understand the way to take the medication, because that can be a life and death situation where somebody takes more than they're supposed to take and continuously keep taking it, and then they end up dying. And there are times when I did meet a lady who said she's been taking medication consistently, but her blood pressure is always over 200. And so she said, I stopped taking medication because I feel like it's not helping me. So again, some of the medications we're receiving in this country are not necessarily the best kind.
Most of the medications that come here or that patients have access to are usually from India, China, and within the sub-region, Nigeria and Ghana. And oftentimes these medications are not very, very qualitative. So safety is an issue, and also efficacy is another big thing. So you see somebody taking this medication for years, they don't get any improvement. Instead, they suffer side effects more. So for her to bring quality medications, which I believe are very, because it's from America, they are very standardized. So I think that is a wonderful thing.
The general population in Gambia are not able to afford just the basic medications that they need. And so that's where we come in play and try to, provide some of those, medications to them.
The program is basically started so we can help people to give back to the community, because we know healthcare is something that's very important, and it's a lot of medications that are lacking here and people can't afford what they have here. So we figured out that giving back to the community, bringing back, giving it to the people who cannot afford it, because there are certain people that can afford it, some people just cannot afford it. So we try to help the people that cannot afford it at all, to make it easier for them, because we have seen they have a lot of high blood patients, we have a lot of diabetes, so those medications are very expensive here. So in order to help them, we thought about joining hands with my sister, so we can come give back to the community and help the people that need it the most.
Some of my friends that come with us are just mind blown at how high some of the blood pressures are that we've seen.
It's been, my God, the need now more than ever. I see, from the US, we do the logistics and everything, but now that I'm on the ground, I see the urgency. Now more than ever, it is urgent. The people need the medicine, people are sick. Nothing is too small. The experience has been, my God, eye-opening. People are sick, people need the medication. That's why the healthcare sector is lacking. Every little bit helps. So anything we can do to help, we're doing. We see all types of diseases. The focus is diabetes and I believe hypertension. But we have seen all types. People come in droves seeking medical attention, pain. Anything you can think of, that's a disease we've seen. We're starting to see children, very small children, coming in from 6 months all the way to like 80 something. Yesterday we saw someone who already had a stroke, and she came in, the blood pressure was so high, we had to stabilize. Dr. Ceesay had to stabilize her after a while, and then she was given medication and let go. Today we've seen another older guy come in, blood pressure is almost to the roof. So definitely the help is needed here. So that's why we're here, to give back, because, you know, we're Gambian. The family is Gambian, so we thought this is the best we can, you know. I believe that to whom much is given, much is expected. So that's why we're here to give back to the community, to give back to Gambia.
Another branch of the OKC that we focus on would be the educational parts.
I have been focusing mainly on education. That's why I started off, because Dr. Ceesay, he's the medical professional. So I've worked in the education field. So we started off with, you know, collecting education materials, books, pencils, chalks. To actually, that time my dad was alive, so we used to collect and bring it to support. From the beginning it started very small, coming to schools. We've selected a few schools to sponsor, like Serekunda School, but now because also the need is great, so we started from giving learning materials now to sponsoring students.
Both my parents were heavy into education. You know, they were teachers for the longest time. You know, they've put so many kids in school. And so naturally it makes sense to focus on that. And my parents would always say, they can take everything away from you, but they cannot take your education, meaning your mind, from you. And you can move to any country when you're educated and be able to make a living. And so education is pretty crucial in helping lift people out of poverty, like generational poverty. It's very crucial in lifting people out of that. And so we try to concentrate on looking for well-deserved students that we can sponsor. And so we now started doing a process where students can apply for scholarships that we give out.
She brought books, pencils, eraser, all the materials I need for my education. She brought all those things for me. Yeah, she said I should try my best because she wants to change my life.
A lot of Gambian youths find themselves that they're not able to transition into college because they can't afford it, you know, their families can't afford it.
She asked me, what are you doing? Okay, so I told her that I wanted to go to the university, but funding is my problem. And then she was like, okay, I will try and help you with that. So I told her, okay, fine. So that's how we started, and then we went to the university, and then I was accepted. So she decided to pay everything for me. Yes, now I am going to American International University. Yes, and then she is even planning to sponsor more students.
She told me that, which school do you want to go? Which university do you want to attend? Then I told her, I want to go to the American International University. That's where we are attending our courses. Then she said, which field do you want to study on? Then I told her that I want to do pharmacy.
And so we have been able to help a few number of students to be able to overcome that financial burden and be able to go to college. We have one who's in nursing school, we have one in medical school, and we have another one who's a pharmacist, and we're also sponsoring a couple kids who are in elementary and high school as well.
I can say it was a blessing, yeah, because since I met her, she has made a great difference in my life, you understand, because I was a nursing assistant, and then finally now I am in the university studying nursing, general nursing. So that's a great thing, and then her initiative is a good one.
My parents cannot afford like university paying how many thousands. So I'm from a low income family. That was a big problem for me. And I thank God when I met her, she changed my life. Because right now I'm in my second year. Yeah, every year they pay my school fees, and any problem I have, if I explain it to her, she will guide me through it. So I thank God for meeting her.
Our next focus for OKC would be to develop our school. We have a land that we're looking to develop as a school, and also to put a clinic there just to further help the goals of the organization that we have, to be able to provide schools for kids and adults, and then hopefully a vocational center as well for training.
The goal is to build a school in Kotu, and we stress the girls' education. You know, you educate a girl, you educate the whole country. So this is the focus. Not to say we're not supporting the boys as well, but the focus is for girls, education. So this was my mom's dream.
It's taking off slowly but surely, and hopefully someday it will be a big hospital or clinic in which we can give back to the community more. Not just go from one spot to another, but it will be a huge hospital, and maybe it will be spread out in the whole of West Africa, hopefully someday, inshallah.
It's a tall order, but we're ready for the work. We're ready to put in the work and kind of, you know, give back to the community and change some lives, you know, and that's the legacy that of the OKC Foundation that we would like to do, because that was what my brother was initially all about, was just to, you know, motivate people, empower the youth so that they can change this country. My brother would always say that, on your way up, lift up somebody. And so that's why we always like to do like random act of kindness. You know, when we come, we bring some clothes for kids, and then just randomly when we're going to a village, we see a group of kids outside, we stop and we give them some clothes, some shoes, you know, and that feels good. You know, that person doesn't know you, you don't know that person, but you might have done something that they would never forget.
And also we bring donations where we take it to SOS, to the orphans, that we will do either late today or tomorrow morning. We'll take some, you know, clothes and different, you know, toys for the orphan kids.
It hasn't been an easy road. So doing the medical missions, we've been here for about 8 years. We're coming on the ground. You know, it's a grind. Every time we come, we have a lot of setbacks. I don't live here in the Gambia. So when I'm coming or setting up these trips, there needs to be coordination between myself and people in the Gambia to help make it successful. For example, housing. I'm bringing people over who are donating their free time, and these are specialists who usually would be paid, you know, quite a bit for their time, but they're donating their time here for free. So a place to stay, car to take us to the clinics every day, just to coordinate that. It takes a lot of effort. We would have to literally pay for our own hotel or pay for our home rental cars while we're here donating our time to help take care of people.
This is a benevolent gesture that she's doing. I hope you know, the Gambia government try to support her more importantly.
I think that is one of the most important things that government has to do with Dr. Ceesay. Because like, if you look at the efforts that she is doing, bringing medications, very essential drugs from America, coming to the Gambia to help people, I think there is a need for government to help her in whatever she's planning to do for this country, particularly with regards to patients with diabetes and hypertension.
We're asking the Gambian people to join us, to support. We're asking the government, because I work in humanitarian. So the goal is, when you come on the ground, to partner with the government. We want to partner with businesses, civil society. So anyone, we're calling out anybody that can join us to help. We're asking you to join us in helping the Gambian people. The medical conditions are dire here.
And so I think that when we put the word out so that more and more gracious citizens are able, those that have the capacity and capability to help out, you know, are able to help out, because we cannot just depend on the government. If it's not getting done, we have to roll up our sleeves as citizens of this country. But thank goodness there are so many like gracious citizens that are willing to stand up and help out. And you know, from entrepreneurs, businessmen, who, you know, and real estate moguls who you know, had made it clear that if you ever need anything because of the work you're doing here, you're helping the community, we will always be willing to stand by you. And so that makes a lot of difference for us, that we have the local support to help give us resources for when we come down here. So many times friends and family will say, why do you keep coming back? When it's tough for you to do stuff on the ground, it's not easy, you can't get a lot of resources on the ground to be able to do the work that we do. But I tell everybody, I mean, if we don't do it, who's going to do it, right? Everybody says somebody should do it. And my mom would always say, well, who's that somebody, right? So it has to start with us. And so we are trying to be that somebody who should be doing something. And we're just doing a small portion of it, but as Gambians, we want to do our small bit, which is, to donate our time. So the OKC Foundation, we come biannually. We'll do medical trips here in the Gambia where we recruit volunteers. So doctors, nurses will all come out, and sometimes the doctors will donate 2 weeks, 1 week, 3 weeks of their time for free. They pay their own air tickets to come here and see patients for free.
I'm a midwife and a nurse from the Seattle area, and I heard of NAFI's program, NAFI, Dr. Ceesay's program, through my sister. My sister works in the same hospital as she does up in the Port Angeles area of Seattle. And I heard that she was planning a mission, and I'd like to contribute to the community. I've done some other medical missions, so I've never been to Africa. So it was my first time to get a chance to come to the Gambia and learn about what's going on, what the resources are, what resources are needed, and really happy to get a chance to come along on this trip.
I am actually a grant writer. I write and find funding for organizations, nonprofit organizations that are doing work across the board. It could be in medicine, education, agriculture, whatever. So I found out about the Ousman Koro Ceesay Foundation because, this is kind of like family. I've grown up knowing them my entire life. And I actually had the opportunity to live in the Gambia when I was 13. So this is the first time I've been back in 27 years, and I was able to bring my daughter with me. So this has been an amazing experience. My goal and part of what I'm doing here is, besides helping with the coordination, I also am working with the foundation to help them get additional funding and to see what we need to bring here. So when I'm writing my grants, it's very important for me to really know what needs to be, what I need to express and convey, because I believe that when I am giving or I'm showing someone's passion through the written word, if I don't have that passion, or if I don't see it fully, then I can't convey it well. So part of this was for me to be able to come and see what it's like to do a clinic, what it means, and the impact that it has. Like yesterday, the opportunity of being in there, handing out medicine, and like I'm doing today, getting different meds and working where I can work while she's doing her job. I get an opportunity to see what the needs are, why we're doing this, what are people really asking for? And I'm also saying, okay, let's write that down, because this can impact how I ask for things when I'm talking to funders, when I'm presenting the Ousman Koro Ceesay Foundation. This is what it looks like. This is why it's important. This is why you should continue to donate. This is why you should want to give money to this organization, because this is the difference that it's making. And it feels so good to me to be able to do this kind of work, regardless to whatever the organization is, because I truly believe that there are people out there that want to give, that want to make a difference, but they don't always know how. And so my objective is to be able to show them this is how you can make a difference. And this is making a difference.
I'm a HR professional. So, but before becoming an HR professional, I used to also be in the medical field. So that's what I did through my college years. So I felt it's time to it's time to come out and support the foundation in full, because Dr. Ceesay is my sister. She's my younger sister. So we work at the back end in the US in the logistics and preparation of the medical mission. So I thought this time it is a good time to come out and support on the ground, in person.
I'm a pharmacist by profession, so what I do when I join her with my student, we try to address medication issues, medication therapy management precisely, and counseling patients about how to take drugs, talk about the indications of the drug, talk about the side effects of the drug, and more importantly, what to expect as far as when you take it, and also drug-drug interaction. So fairly, that will give her enough time to, because she's a medical doctor, obviously, she can diagnose, so that will give her space to spend time with patients to do her diagnosis thing. So once diagnosis is made, we make recommendations as to what medications would work.
If I get a little lazy sometimes, oh gosh, we have to set up another, trip again, and it's very labor intense to have to set it up and coordinate the donations, have to ship the materials here by air cargo. Those are all very labor intense. So sometimes you feel like, oh my gosh, why can't I just go on vacation, put my feet up for the 2 weeks instead of going to donate my time in Gambia and see patients. And so I hear my parents' voice and I see my parents in my mind, what happened to them and how I wasn't able to save them. And that's what motivates me and drives me to just get off my butt and say, you know what, I have to go this time because I need, I might be able to save somebody else with what it is that we're doing. And so, yeah, that's the number one thing that keeps the drive, for OKC to keep coming back. It's just for us to do and try to save as many people as we can. It's an ambitious dream, but, we're taking it one day at a time, trying to do the best that we can.
After having this experience and now having more of an understanding of how things work, how to get around, I feel like I would love to come back and I'd be a much more useful, each time you come, you're building, you're learning, and being able to be more focused in your own specialty. So that's my goal, is to come back again. And now that I know what's more useful to be able to bring that, maybe I'd love to do some more trainings. I love education. I've done a lot of clinical education, training midwives, birth attendants, community healthcare workers. That's really my specialty. So, and today's our first day out in the village. This is where I'm most comfortable. In my prior work, I did a lot of community service work. So I'm kind of eager to get back out in the village and do education. Education is really what I'm most passionate about.
I'll try to organize my job schedule so that I can come every year. If not 2 times a year, but I'm committed to coming every year.
We will come back, inshallah, because you never know what tomorrow brings, but by His grace, if we are still alive, we will be coming back.
It is a wonderful thing she's doing, humanitarian, and most of it is concentrated towards healthcare, which is a very, very, underserved services that is provided in this country.
What she is doing is really great because many people are in the Gambia here. They are having this condition, hypertension and diabetes. You understand? But the problem is that medication. Medication is their problem because you will see a patient with a high blood pressure and then she's not taking medication. The reason is that they cannot have the money to go and buy the medication. They cannot afford it. But this woman has made it easy for them. She's bringing medications and giving it to patients for free for 6 months. So that's a good thing. And then, yeah, people really appreciate her work. Yes, especially the old age, they really appreciate what she is doing. Because whenever they hear that she is around, they all try to come and grab their medications for 6 months duration. And then with that, they are okay.
They are doing a very good job for the country and for the whole nation. So we are very happy to thank Dr. Ceesay and the team and co. So for the good gesture they have brought for us in the Gambia.
ala baraka halna ta de maro men ala ma ala alma ko ali alna tan tol men fana ma ko ala mare ala man be so la jaati ken de ama ala alma ko na al bi de ma ala baraka
we don't know how much we can appreciate it. So we just appreciate Dr. Ceesay, praying for her and everything she needs so that it will be okay.
We are thanking her very much for what she is doing for the Gambia, because we have a lot of people here whom you know they can't afford to cure themselves because of money.
Yeah.
So when you have somebody who is assisting you and wanted to help you, so you have to thank that person.
Oh, Doctor Olula Nadia tanye jambak. Bawo iben tolle mako kajata kende abunda. Sasa be siari si fali mankilia. Doli si solle kedimi e doli yele selole bela doli kungolle kedimi doli telle kaledimi doli kulollo kono kedimi doli kono le kedimi. Kuna wasifa mankilia bare fele benjara kan. Ngala tentu wala nge fanan tentu wala nge mbedu ale fanan si maala ni jata kende. Ani ala sela harjeli firing ala sen ni beso jata kende ala katon kura o ate mokilin tante. Na biya je dola soma e bajela dola fanan na do jato be kende are mbi soma sa dola fanan ka fanan mutabar ne ngale makwe ngela nyumboro lu soto. Tumandom be jata kende asoto lale. O jata kende o ka bo ala barbare tollo sababote. Mbedu ala ali simala ninja takenda ngali tentu ngali jayi ngali nimbara fana ngali bismillah nasate to fana ala baraka yam.
Dr. Ceesay, I say thank you very much for what you are doing, because for drugs in here to buy is very expensive.
Yes.
Just want to tell her to keep it up the good job, because we really need somebody like me. Diabetes is a very expensive treatment. If I don't get medication from the public health, the government, I can't afford to go and buy the private sector. So it's a bit for the Gambia. So let her just continue doing that. I'm really happy for her. I'm proud to be a Gambian. My fellow Gambians is helping me.
Unung kanu sagada sara baraka unung kanu lumo fune gi fo buje nu ni le katonge ano jangari e yemetedi no limoti hibuna ite isauni ye ni lombongani se bilu ka hisima jata kendia wa ho ay wangani se limoti kata ko
We have seen your kindness because you have left all people and come to Katong. We are grateful for you. We thank you very much for everything, your efforts.
I'll say thank you to Dr. Ceesay and the team for coming to the Katong community. We are very grateful. Getting money to buy medication for ourselves would have been a problem. Once we have this opportunity to get this treatment free of charge.
Betay munuma faju comme dama ko bëgg dama day jënd garab aw ma halis pour jënd garab suñ ba séné lab dama day fay lab ma ngi ñaanal Dr. Ceesay na fi Dr. Ceesay ma ngi ko ñaanal bu baax ala place am bi yo yalla may ko wër yeen yépp yalla ngeen yaaga ci seen liggéey di ngeen yalla na leen ko barki suñ borom di barki alquran ma ngi ñaan dimbalé ngeen dimbalé ma ndik suma goyta bi ni suma dem pour def laab ma defé xaliss bu bari suma démé tab dañ ma dé bindal ñu na ma dem jënd garab ñaata at légui fukki at ma ngi jënd garab dafa metti wa ko rek la am pour wax
boro ni nata boro ngi non lagi boro ni dinna ko lon se boro ci ko le kandim baye boro dinna ko lolu ngakile mingi baraka baak
Lasia bobu mom ñewut affaire corona bi waye fu nekk ni ñu ngi sante yalla corona bi jeexna léegi Dr. Ceesay ñu ko ñaanal yenn yàlla yokk liggéeyam ci kanam jox nañu garab parce que soo gisee ñu óolu pour dem ci moom daf ñu daan jox garab ñu ko dee naan mu baax ci ñun kon donc su nekkee na ñëw na foog ñu dem ba ci moom ñu ñaanaati ko garab loolu moo tax ñu ko ñaanal yàlla liggéey bi yokk ci kanam yéen ñëpp yéen leen yàlla ekkati ci kaw yàlla yokk seen liggéey bi yokk seen place yi ci barke yoneen bi ci barke alquran baax na maa ngi leen a gërëm di leen a sant dégg nga thanks.
He said he's very happy to be here, and he's very happy, and what he wants today is that let the doctors help him to get out of this situation, and he has the hope because they give us some medicines. He should use this for almost 5 months. Every day he should take one. Yeah, so he said he's very much happy of being here.
The need is great. There's so many people who are in need, as far as youths and even adults, you know, who need to go back to school and you know, improve their lifestyle. And so we try to give back any way we can to make that possible for every few. We're not going to be able to help everybody, obviously, but you know, the little we help, the better, because there's this saying that says that when spider webs unite, they can tie up a lion. You know, so that it takes a lot of spider webs coming together. So OKC is just one spider web. And then if we have more spider webs come together and we unite, we can actually tie up a lion, which is this education issue that we have and also healthcare issue that we have.
Danga buga yone halis baye ko UK ñew bir Gambia li nga def yomba na Remit ñoo leen fi nekkal. All you have to do is download the Remit Continental app, which is free on iOS and Play Store. Xam nga yeen mom da ngeen buga yifi free. You don't need to pay anything for the app. You just have to download it and register. And when you register, send money to your loved ones in the Gambia. Remit has better rates. Send rates dafa ba amut fen. And it's fast. Wana len Remit dañ nan gaaw holal ñoo gaaw dañ fast. The fast lane bi lañ nekk di daw. Remit is very fast. When you send money, immediately you send money. The person in Gambia here will get it. Dina ko dem receive te du si am ben choono. And guys, it's very simple to use. Like I said, the app is simple to use, secure transaction. So guys, download the Remit Continental app now and start sending money to your loved ones. Man kila may waxa yeen ci lumay na dugal rek dafa leer. Kon bi dafa leer nañ holal bi dafa leer nañ ni suba teel.
Welcome to The View Apartments, your #1 deluxe and premium apartment rental services in the Gambia. The View Apartments conveniently offer both short and long-term stay at affordable prices. We have different facilities that suit your needs. Our guests have a convenient access to our spacious self-catering kitchen, giving you a home experience away from home. We offer premium fully furnished apartments. All our spacious rooms are en suite with bathrooms and comfortable facilities that enhances your comfort during your stay. Enjoy free Wi-Fi in a well-ventilated apartment, fully air-conditioned with a view to the serene environment. We are located right at the heart of Bruceby Phase 1 with an easy access to the highway. Contact us today to discover our premium apartment rentals from the smiling coast of Africa.